Welcome to Health Focus, where we focus on your health. Today we're focusing on coronavirus, which is really a rapidly evolving situation that all of us are concerned with, both here in the local community and nationwide. And we're very pleased to have an expert on public health with us, Dr. Bela Matyas. Welcome to the show, Dr.
Thank you very much,
Dr. Matyas. And you're with the Solano County Department of Public Health. Tell us a little bit about what you do there.
Yeah, so I'm the health officer for the County of Solano. I oversee the public health programs in the county. In California, we have health officers in all of the public health jurisdictions that are local, and Solano is one of those.
Well, we couldn't pick a better person to be here, and I understand you're a graduate of programs such as the University of California, San Diego School of Medicine and Harvard School of Public Health. Is that correct? And you're trained in occupational medicine and public health as well, right?
Yeah.
So we really appreciate your lending your expertise to this subject. Now, I mentioned this is something that we're concerned with both locally and nationwide. For example, the Wall Street Journal has had recent articles on this indicating that potentially this can affect our economy. But more importantly, they have described up to 72,000 cases in China with nearly 1,900 deaths. And many people think that's an underestimate.
Yes.
I think thoughts on that?
Well, I think it's definitely an underestimate. It's very, very difficult right now in Hubei province to be keeping track of how many cases there are, how many people are dying from this versus other causes. This is a very large epidemic within that province, and those are definitely the low end of the likely numbers of disease. I think that the message is that this disease is in its growing stage. It's going to continue to expand very rapidly. In all likelihood, like previous similar diseases, it's going to spread around the world and become a pandemic affecting multiple countries. We already have evidence of that. We've had multiple outbreaks outside of China already. They're nowhere near as large as the sustained outbreak in Hubei province, but you've probably heard about the cruise ship that's been quarantined off the coast of Japan. That actually represents the second biggest outbreak in the world at the moment. They've had several hundred cases on board that vessel. But cases have been reported with local spread from person to person in multiple other locations as well. So unfortunately, we're really only at the beginning stages of this particular disease.
Right. In fact, we were scheduled, my wife and I and our kids, to go on a cruise on that very ship. And we elected to change our plans, or else we might have ended up on that ship. And it's really very distressing to imagine being stuck in a cabin on a ship for 2 weeks in quarantine. And it sounds like it wasn't even really entirely successful because the disease really spread through the ship, which in a sense is an enclosed environment that is conducive to the spread of disease, is it not?
Yeah, I mean, when you think about it, a ship with several thousand people on it that is out at sea for a prolonged period of time is just a big incubator. And so individuals interacting with one another are going to spread the disease. So I think the concept of quarantine was less for those people who are on the ship than it was a quarantine preventing them from entering onto land somewhere and spreading the disease in that location. So I'm not sure when we think about the quarantine that we're really focusing on the right aspect of it. I think what we were doing is quarantining them from entering Japan rather than quarantining them for themselves.
Excellent point, Dr. Matyas. And I understand that there really is widespread concern that perhaps the Chinese authorities are not being completely forthcoming with respect to how serious this is in China, and that the numbers that we've seen, 72,000 cases, 1,800 deaths, are probably a great underestimate of what's really going on. Do you have thoughts on that?
I don't think that there has to be any malintent on the part of China for those numbers to be very, very low. In the middle of something that is exploding that rapidly, it's very hard to keep track of things. People are falling ill all over the place. Their emergency rooms have been flooded from the beginning of this. Very, very hard to keep track of the counts. It's very, you stop trying to take samples on everyone who's sick when you're just trying to make sure that they're healthy or that you can keep them from dying. So your focus is on dealing with the illness and the individuals involved, not on counting things. So yes, it's probably a very significant undercount, but I don't think you have to ascribe that to anything more than the chaos that accompanies this type of situation.
Dr. Anthony Fauci at the National Institutes of Health has been interviewed extensively on this subject, and he has made a point of saying that many of the physicians in China, in fact, trained in the United States and are superb clinicians, and he echoed what you said, that there's probably no malintent, and that he trusts them as individual colleagues and friends, but that just the scale of the problem and the fact that there may also be some political aspect to it can sometimes make it difficult to really see what's going on.
I think that's true. And, you know, if you look at how we here in the U.S. have been reacting to individual cases that show up in one location or another, we get very concerned, and hospitals have to retool how they handle things to deal with one person. You can well imagine what it's like to deal with thousands of people, with a similar situation. In China, in fact, as I understand it, they actually built a hospital specifically to focus on individuals with this condition within Wuhan. And, I think that's a testimony to the scale of the problem that they're dealing with.
Yeah, I think they put it up overnight practically, in fact. And since you mentioned it in terms of the local community, we've had, according to the Daily Republic, as of February 19th, 2020, Napa confirms COVID-19 case from Travis. Of course, some of the individuals who were on the Diamond Princess returned to the United States via Travis Air Force Base. And there are suggestions that there may have been at least one case in the community, I believe at Queen of the Valley Hospital. There's also a young girl who returned from China and perhaps for no good medical reason has found herself subject of fear on the part of her neighbors and has taken to wearing a mask and sort of self-isolating herself, which I think is potentially emotionally harmful to a child and really a very sad commentary on what can happen when fear takes over and people react with fear. Do you have any thoughts on that?
Yeah, you're actually raising an extremely important point on the second issue. The challenge of dealing with a disease that we know little about appropriately, and at the same time addressing the reality of how humans react to that, the fear that follows. And we've been trying very, very hard to minimize the risk of ostracizing people who have been returning to China, who are simply tourists. They were visiting family, and they've returned, and now they're being treated as pariahs in many communities. And so our approach has been that we identify people who are returning travelers so that we can help them monitor themselves at home and make sure that if they get sick, we know about it, and we can then hospitalize them, test them, et cetera. But at the same time, maintain their confidentiality to the extent that we can, because it is not through any fault of their own that they find themselves in this situation. And the truth is that virtually none of the returning travelers in this situation have coronavirus. We have not yet had cases like that emerge as coronavirus. The cases we have had in the United States so far have all been individuals who were in Wuhan province who were evacuated in the initial State Department evacuations related to that, individuals who were from Wuhan and returned directly, and more recently individuals who were on the Diamond Princess also experiencing a large outbreak. So most of the people returning from China, other parts of China, have probably not even been exposed, are not at risk, but out of an abundance of caution, we're asking them to stay home for 14 days as though they were going through a quarantine, just so that if there is something, we'll learn about it with fewer people having been exposed. Unfortunately, the downside of doing that is that they get labeled. They become identified. If they self-identify, they're now unfortunately potentially the target of people's fear.
Well, let's try to shed a little bit of light on exactly what's going on with this virus. So first of all, I've been calling it the coronavirus, but I believe the virus has been characterized now, and it's really not called the coronavirus medically. Isn't that correct?
Well, so there's the name of the disease, which is COVID-19, which is coronavirus disease 19. We've run out of good names for diseases, so we're just going with a simple paradigm. And the virus itself is SARS-CoV-2, which indicates that it's a coronavirus very similar to the one that caused SARS in the early part of the 2000s. And so its viral identification is SARS-CoV-2, its disease identification instead of SARS is COVID-19. But they're both referring to the same thing. It is a coronavirus. Like other coronaviruses, they often start in an animal population and work their way to people. Once they make that jump to humans, a few of them can then transmit. And because they're new to us, we don't have the kinds of immunity we do to other viruses, they spread very rapidly. And so this disease is demonstrating very similar spread patterns to what we saw with SARS. But the disease itself and how it affects us is not that different from how flu affects us. It is a disease that affects our respiratory system. It can cause significant disease. In some people, it can be fatal. We've seen a lot of deaths. And that's why we have to treat it very, very seriously. But it's essentially spread in the way that flu is spread, which is primarily through the droplets that come out of our mouths, out of our nose. So you sneeze, you cough, you cough something up, and it's on your hands. The people in close proximity are the ones at greater risk, much as we have with influenza. The difference is we don't have a vaccine, and so prevention has to be this sort of protect yourself from the spread of the droplet.
You know, we've seen this before with other infections, haven't we? For example, swine flu.
Mm-hmm.
And indeed, there are some suggestions that in a totally unrelated virus, HIV, that the origin was probably in non-human primates in Central Africa.
Mm-hmm.
In this case, if this is an animal-borne virus, I believe bats have been mentioned as possibly the original host.
Yeah. So
Do you have any information on that and how what we would call a zoonotic infection or an animal-borne infection made the jump to humans? I know that the markets have been pointed out in China. Do you have any insights on that for us?
So when diseases jump from an animal to a person, it's usually in a setting where you have humans interacting very closely with the animals. So it's in animal husbandry or in live animal markets that we see these types of transitions. And if you look at the past half dozen or so zoonotic diseases that have affected us, mostly coming out of places that have live poultry markets, that's been the sort of final connection to people. The origin of this virus is probably the bat, but there may have been an intervening animal in terms of transmitting to people, because SARS started in bats but went into civet cats, and it was the civet cat that the contamination with people that actually caused the transition. And the MERS, the Middle Eastern Respiratory Syndrome coronavirus, started in bats and went to camels and then to people. So we don't know that there wasn't an intervening animal here. So bats may be the starting host, but there's probably other steps involved. But the humans interacting closely with animals is the mechanism of transfer.
So with respect to, for example, a bat or a civet, are we talking about eating the animal, or are we talking about inhaling something from the animal's exhaled breath? What would the mechanism be?
It's usually inhaling something from the animal's coughing, sneezing, or breathing. It's usually a respiratory transmission,
Right.
not the eating. Unless you eat it raw, then there's some potential risk. And I don't want to say there's no risk of eating it, because we don't really know. It's hard to tell, because if you're in an animal market and you're interacting with the animal, then you bring it home and you cook it, which of those interactions caused the spread is impossible to know. But we do know that these animals often spread the virus in their respiratory secretions, and so interacting closely with them, like checking them out in the market or raising them, would represent scenarios where you could be exposed.
And what is the incubation period for coronavirus?
We don't know for certain what the incubation period is, so we're using the knowledge of the two prior similar ones, SARS and MERS, and we're going to 14 days as the window of maximum potential transmission.
And the minimum would be, what, 2 days?
Probably 2 days. It could be a day and a half, maybe at the shortest end if you get a big dose.
SARS is also a similar, it's in the same family of viruses, the COVID virus or the coronavirus family.
Yes, and we're using information about that to help guide us here, because it is so
Right.
similar.
What does SARS stand for?
Severe acute respiratory syndrome.
And MERS?
MERS is Middle Eastern Respiratory Syndrome.
Okay, and they're both coronaviruses.
They're both similar coronaviruses to one another and similar to this one.
If an individual is developing this condition, what symptoms would the individual experience?
You know, like most of these diseases, the majority of people probably have no symptoms, or symptoms so mild that they don't recognize it. But when you start to develop the symptoms that we attribute to it, we're talking about things like coughing, shortness of breath, difficulty with breathing. So the sort of the lower respiratory tract infection symptoms that you get, for example, with influenza, accompanied in many cases by fever. But a fair proportion of people, about 20%, also seem to have diarrhea. So there's some diarrhea accompaniment for many people, but it's mostly the respiratory symptoms, things that you associate with, for example, influenza, are similar to what we see here.
You know, a colleague of mine pointed out that other coronaviruses do in fact cause diarrhea, and he specifically asked me to inquire, do you think this might be spread by so-called oral fecal contamination rather than via droplet contamination? In other words, people contaminating their hands with fecal matter and then preparing food. Do you think that's a problem with coronavirus in a major way?
Well, so I can't say that can't happen, because
Yes.
clearly it's causing diarrhea. There may well be virus in the diarrhea, but I can say that too few people develop it for that to be the main method of spread. The main method of spread is definitely respiratory. And even with people who have diarrhea, they're still producing respiratory secretions with the virus. It's much more efficient to transmit the disease through droplets than it is through feces.
We had a guest on the show previously, Dr. Warner, and the subject was influenza vaccination. And I think it's interesting that we seem to have a very poor ability as a people, as a population, all of us to some extent, to sort of perceive risk. So that, for example, in the United States, I believe we've already had over 10,000 deaths from influenza this flu season. And yet only about 60% of people get immunized against the flu. Yet there is obviously a worldwide anxiety about coronavirus.
Yeah.
Would you not agree that, in terms of actual day-to-day risk, one of the best things people could do is just get a flu shot and exercise the precautions necessary to avoid the common flu, rather than worrying about coronavirus?
Well, I wouldn't, that's a very tricky question because
Okay.
risk is a perception.
Yes.
You're referring to hazard versus risk, and risk is complicated. Risk includes your perception of what you may or may not befall for harm. So if you're used to something like flu, we hear about it all the time, it's often diminished. The risk perception is diminished against the hazard that it really represents. Yes, influenza will kill far more people than this virus will. And why don't more people get vaccinated is a struggle for us in public health all the time. We recommend vaccination because it's a wise thing to do to prevent a disease that can be as harmful as influenza. And so I don't think that that's the only element of it. There is the sense that this is new, we don't know enough about it. This particular coronavirus probably has a higher case fatality rate than influenza. The reason influenza causes so many deaths is because it affects so many people, that even if it has a lower death rate, you'll still have larger numbers. This disease, the new one, has infected very few people by comparison to what influenza has infected, so we don't really know what the comparables would be. Point is, they're both bad. And the other point which you make, which is very important, is that they're both predominantly spread by droplets, so the precautions are the same. And so avoiding contact with one another's respiratory secretions is the way that you protect yourself from droplet-borne diseases. You cover your cough and your sneeze with your elbow or with a tissue. You stay home from work or school if you're ill. You make sure you wash your hands frequently, and if you're in an environment where people are potentially spreading, you make sure you wash your hands and don't bring them to your mouth until you've washed your hands. So those precautions fit all droplet-borne diseases. And you also note, and I completely agree, that flu vaccination is helpful for coronavirus, because flu vaccination will at least eliminate that as a possible source of your symptoms and will reduce your risk of bringing harm into the healthcare system.
Dr. Anthony Fauci was interviewed about the case fatality rate in this disease. And I believe, as you point out, it's higher than flu. I think in flu it's far less than 1%. And for this disease, it appears to be, if I'm not mistaken, higher. Perhaps, is it 1 or 2%?
It's hard to tell because we don't know how many non-symptomatic people have the disease. So.
Well, that's what Dr. Fauci pointed out. He said the problem is that there may be many people who have more mild cases of the disease who never come to the attention of authorities.
Right.
And that would tend to inflate the perceived mortality rate by diminishing the denominator of people infected.
Absolutely true. But that phenomenon is true for flu as well. We actually have no idea in any season how many people have flu. We just know how many present with symptoms. So if you start with how many people with symptoms then die, it's not a genuine case fatality rate because we don't know what the infected denominator was, but it's the observable case fatality rate. And so for that, I think the comparison is probably more fair. And I do believe that the observable case fatality rate for the coronavirus at present is considerably higher than flu.
Dr. Matyas, let's focus on how to prevent acquiring this illness. First of all, you mentioned hand washing. I would say that includes both with a sink for probably at least, 30 seconds?
Yeah, with soap and water.
Soap and water. And also hand disinfectant?
Yeah. Well, hand disinfectant is a backup if you don't have the ability to wash your hands in a sink.
Very good. How about masks? There's been some literature on this. On the one hand, masks are not impermeable to viruses. On the other hand, if this is spread by droplets and the mask absorbs some droplets, certainly the inoculation dose would be less wearing a mask. So do you have any thoughts on what kind of mask a person should wear? Most people don't have access to non-rebreathing masks and sophisticated masks.
That's always a tricky question because masks have value in situations where you're dealing with the virus being present. So in the healthcare environment, with physicians and nurses and other personnel taking care of these patients, we strongly recommend protection on their part so that they don't get exposed. We also recommend that the patient wear a mask until they're in isolation so they don't spread it as easily. But in the general public, this disease isn't out there for you to be exposed to. So the idea of wearing a mask to protect yourself from strangers who you're afraid of, it doesn't resonate with the reality. The reality is that there isn't disease in our community spreading around in a way where wearing masks would have any benefit at all. The other issue that I want to note about masks is that, if you are wearing a mask and you don't know how to wear a mask properly, you're violating its integrity constantly. And if you're interacting with a person, let's say you shake their hand and you're wearing a mask, and they cough, yes, you might prevent some of the droplets from getting into your mouth, but you just shook their hand, you're invariably going to touch your mouth or your nose at some point before washing your hands, and you've gone ahead and transmitted anyway.
Okay. Do you have any information on what's going on in terms of individuals coming through Travis Air Force Base and Fairfield and the potential implications for the health of the county? Mm-hmm. And is the county actively involved in this in terms of contingency plans, coordinating with other agencies and so forth? Could you tell us about that?
Yeah, so this is a federal mission, and the locals, the state, and the federal government entities that are working it are all working very closely together. We have 4 or 5 conference calls every day since this mission began, so we're having excellent communication about who has what responsibility, how to work with one another. There is no risk to the community at all. These individuals are held in a quarantined location at Travis. They are transported by ambulance to a hospital isolation environment directly. So if they need to go off base because they have symptoms, they're going from essentially quarantine to hospital, and there's no risk to the community at all.
If I may challenge you on that, I don't see how one could state that there's no risk to the community, because having been in the military myself and having been at Travis, whenever you have employees, you have people coming and going, even if you have someone in isolation. And sometimes people don't follow all the rules. Certainly an employee could come in contact with somebody who's in isolation, become inoculated with the virus, and then return to home in the community and spread the virus. So I would accept that perhaps the risk is perhaps low, if that's your opinion and from your expert perspective. But
so Travis
to say no risk seems to me to be improbable, wouldn't you say?
So Travis employees have no contact with the clients in quarantine. They're fully handled by CDC, HHS, U.S. Marshal staff. Those individuals need to follow proper precautions. Right. Those are not our residents, so they may pose a risk to their home community if they didn't do a good job and they return to it. But what people worry about is that by having this person in an ambulance going to a hospital, that puts the community at risk, and that doesn't, because that's a contained transport, it's a contained transfer. I'm not on base in the quarantine location to note how effectively people are maintaining their PPE, and one could argue that there can be breaches of PPE elsewhere as well. I would suggest that that's not a community risk, that's a risk of the professionals involved in the client. If they become ill, they may then create a community risk. So I'm not saying that there's no risk to our community for coronavirus, because there are so many ways it can enter. But this particular operation is not putting our community at any risk.
Well, would you not say, though, Dr. Matyas, that perhaps it would be more accurate to say it's not putting our community at what you would view as a high risk? Because for the reasons you just described, there's some risk. The ambulance personnel may have relatives and friends, the individuals going through the community. The risk certainly is not zero. You wouldn't suggest that, would you?
I think there's a difference in talking about that with an expert who understands the concepts of quantitative risk, and I would say, of course not, nothing has a zero risk. But from a pragmatic standpoint, if I were to be asked by a person who was trying to know that answer in terms of what they should do about their life, I'd say there's no risk to you. Go about your life.
Okay, very good. Our time is running short, so I'd like to kind of ask about the future. Do you see a vaccine being developed for coronavirus in the near future? I know that the virus has been characterized by some high-level virologists.
I have 2 answers. One is that I've been reminding the people at the CDC that Cuba Gooding Jr. in outbreak had a vaccine within 20 minutes. So what's wrong with them? They don't tend to like that answer very much. So I'll go with the other answer, which is yes, they are likely to develop a vaccine, but it's not clear that we'll need one. If you recall SARS, it came and it went before it was possible to have widespread vaccine, and it essentially disappeared. So really the issue is, will this be a disease that becomes a permanent fixture in our communities, and then a vaccine can be very helpful? Or is it one that will come and go, in which case a vaccine is not going to make a difference in terms of subsequent risk of this disease? So
we've had recent stock market activity, and I realize this is a human crisis, not a financial issue primarily, but nonetheless, on the day we're filming, the stock market essentially crashed due to the word pandemic being used. and the assertion that perhaps we're moving from an epidemic to a pandemic. As a public health official, is that an accurate statement? And what do you see as the worst case scenario for Northern California?
Well, I do think we're moving toward a pandemic because multiple countries at this point are experiencing propagation within the country. And so there are epidemics or outbreaks, if you will, in multiple locations. The cruise ship alone represents a second location. And where we're going to is probably where we went to with SARS, that we were going to have to focus heavily on healthcare institutions not to become sources of spread.
And where can the public go to get more information, particularly from I realize that we're on the air in Davis and various counties, but in Solano County, where might they go for information? And in other counties, where might they go? What websites, for example? Do you have any in mind?
Yeah, definitely the CDC.gov website on coronavirus is the most up-to-date in terms of scientific information and numbers, what's going on in the world. More locally, the California Department of Public Health website is mirroring the CDPH website with more local information as well, or is mirroring the CDC website with more local information as well. And all of our counties pretty much have a lot of coronavirus information on our local websites also. So the websites for the local public health department, the state health department, and the CDC would be the best locations.
I'd like to thank you, Dr. Matyas, for joining us, and also for the great work you do on behalf of the community, not just in terms of the county treating sick people, but in terms of education, outreach, coordinating with other agencies. It's very important. In fact, we've had one of your colleagues, Dr. Shandi Fuller, on the show to discuss vaccinations. And our philosophy on the show tends to be geared towards education of the public and prevention. And I think having just a superb guest such as you with your educational and professional background makes all the difference in the world. So I hope perhaps
Thanks.
in the future you'll come back and visit with us again.
Happy to. Thank you very much.
Thank you. Remember, here at Health Focus, we focus on your health. Today we focused on coronavirus, and we hope that this has been of help to you. And we wish all of you the best in your lives in the community and look forward to seeing you back again. Thank you so much for joining us.